in a distress because of this pollen allergy or hay fever. That's why I chose this topic. Uh, so I will start. So allergies are very common in this part. About 20% of people are affected by allergic rhinitis, which is runny nose, sneezing, and everything. 6% of people are having food allergy. And about food allergy, I will like to say that generally we think, or the parents or the person is told that you cannot get cured if you have any food allergy, like if you are having milk allergy or nut allergy, you have to suffer it till the till your lifetime. I will share one case of food allergy. In the baby was born, and how we got to know that she has food allergy and how we cured it, and homeopathy cured it. So, food allergy, atopic dermatitis, which is a skin problem, and there are so many types of allergy, so we will talk about it. So many people have it uh, in the form of one or other, either skin or breathing problem, asthma, or nose or eyes. So we will talk about it. So what I will explain in this presentation is allergy, allergens, what happens in our body, what are the signs and symptoms, how homeopathically we can manage it, what is the homeopathic point of view of allergy? What are the rubrics in our repertory? And some one, two cases I will like to share. So, what is allergy? Allergy is hypersensitivity of our immune system. So, a person who is hypersensitivity to one substance which is otherwise causing no problem to another person. So, in this pollen season, not everyone is getting trouble, and so this is allergy. This what we call it allergy, and the substance which is causing problem to a person is called allergen. And how our body takes this allergen, either by ingestion, means by ingesting it, or inhalation, by smelling it, or injection, or skin contact. So, in people with allergic disease, the immune system of us reacts with those harmless substances and cause allergic reactions. What are the common allergens? These allergens are food substances which are by ingestion. These can be anything. Common are egg, milk, fish, and nuts. But like Dr. Rakhi told in last lecture, that every person is specific. There is individualization, which we homeopath understand. So it can be banana, it can be apple. You have to see your body, what you are eating and what thing can cause you the problem. So we have to notice those substances. But these are the common ones: eggs, milk, fish, and nuts. Second is environmental factor, which we take in our body by inhalation. That can be pollen, dust, grass pollen. When we mow the grass, here it is very common, the freshly cut grass, and a lot of pollens or grass pollens come, and they causes a lot of problem. Then chemical substances which come in contact with our skin. So the jewelry, the different type of artificial jewelry, paints. If some, you must have seen or you must have listened that we just painted our home and then I started sneezing, or I have so much swelling on my face, or we shifted to a new house and I got this problem. Sometimes nowadays people are very much aware that these can be the causes, and sometimes the person who is coming to you, they don't know that why we just moved to a new house and I don't know what happened. Is there anything in that area? I tried everything, but it may be the newly painted house also, or gloves, plastic, anything that can be there. And then there are some medicines to that people can be allergic. They are common are penicillin injection. So these are the common things, but like I am saying again, that you have to see your body. Every person is different. The thing which is very common and can causing no problem in any other individual can cause problem in you. So what happens in our body when we come in contact with these allergens? So the main thing is a substance which is called immunoglobulin E. These are the antibodies which is called IgE, and these antibodies are part of our immune system. So these are responsible for the allergic reaction. They bind to an allergen, whatever we are taking from outside, and then they attach to a mast cell or basophil, which trigger the inflammatory chemical. I will explain it to you. So most allergies are mediated by IgE, which I told you are part of our immune system. They are produced when body is first exposed to an allergen, but that first exposure is generally harmless, they asymptomatic. We don't see any symptoms in that. Then they bind to a receptor on the surface of the mast cell. These are the cells which releases the histamines. Histamines everybody know, because if they are having allergy, so everybody know we are taking antihistamines. But upon re-exposure of the same antigen, the antigen binds to IgE molecule and releases the histamines. These are the inflammatory chemicals, and then these chemicals can cause the problem. They can there is vasodilation, increased permeability of blood vessels, mucus secretion, and allergic symptoms are there. Common signs and symptoms are generally eyes, nose are affected. So watery eyes, itching, redness, swelling of the lids, inner corner, outer corner. I saw a patient who has this big eye because of allergy. Both the eyes were so big. So, then the nose, then there is nasal itching, runny nose, they cannot breathe, blocked nose, they cannot sleep. There can be headache related to sinus. It can cause allergic sinusitis. Then airways, if the allergens are causing problem in allergic airways constriction, which is causing asthma, difficulty in breathing, and then skin rashes, hives, urticaria, redness, itching. These are the common signs and symptoms, but there can you have to see and you have to take history. That is the basic things in homeopathy are the most important things, like taking case history. Like one person 2 3 days back, the lady came to me and she says, I don't know, I have so much gas and bloating, I can't eat, I can't sleep, and then I have chest pain also. And then when I started talking to her and taking case history, then she told last year also in this season this happened. Generally, so these are the allergic symptoms of the gastrointestinal tract. She was having in these particular months, she was having this problem. And the doctor, then I don't know, I went to GP and doctor said it can be allergic, and she gave some antihistamines tablet and then I was fine. So allergic, you have to take proper case history. You have to see what is happening, how is happening, basic things, taking case history, looking at the patient, how he is coming, which we learn in our first year of college. Those are the most important things. And then we can progress in the case. Yeah, so management, definitely one thing is we will give according to the patient, we will give the homeopathic medicine. That is the important part. But management is also very important, and it is very difficult to manage these type of cases because you are living in this type of environment. There is continuous maintaining factor of pollen. If you are allergic to pollen or grass pollen or anything, so you have to bear it. You cannot leave the country, or you have to manage those things. So what I have seen in this practice of allergy, where I managed to cure some cases. There are some managements. So if there are pollens, you should close the windows at night. If you are seeing that they are mowing the grass, you should not go to that place or cover your mouth. Before, patients used to little bit invent that they will close their mouth, how they will look. But after COVID, everyone is wearing masks, so they are okay. They can cover the nose and mouth. Then change your clothing if you're coming from outside, because pollen grasp on every part of the clothes. So change your clothing. Then very important thing which I noticed, that put petroleum jelly. We have Vaseline or some petroleum jelly on your eyes, nose, and around the mouth. So what happens? These pollen stuck on that jelly, and you don't inhale that, or they don't affect it more. And when you come back to your home, wipe those parts, so pollen doesn't affect you that much. Then yoga is very important because it increases your immunity, and do breathing exercises, anulom vilom, pranayam. That is very important because they increase your resistant power, definitely. And one more thing, jal neti, I will explain what jal neti is. Jal neti is very, very helpful. There are so many people who get better with this jal neti. In this comes in ayurveda. There is one pot with a nozzle, and you put the water in one nostril and it comes out from the other nostril. This is Jal Niti technique. Then again you do it from the other part of the nostril and it comes out. So what happens? All the pollens, all the allergic things, if they are there, they come out, and it benefits. Jal Niti is very beneficial. It benefits a lot of people. Then, if you are having allergy from any substance like metal jewelry or rubber or plastic, then you have to avoid any food you are seeing that whenever I eat this thing, I feel it's not necessary that you get sneezing or you get rashes or anything. Dis-ease, when you are not at ease. If after eating of anything you are not at ease, any problem, you are facing any problem every time, then stop eating that. And no need to do allergic tests, to go to a doctor and do allergic test. Your body tells you on its own that yes, there is the problem with this substance, and you can do that. Food you should avoid, uh, exposure you should avoid, the medicine if you are having, you should not take that. You should know that I am allergic to this medicine. The rubber or plastic or metal jewelry, if you are allergic to those, you should avoid that. So this is the management thing. Then homeopathic point of view of allergy. So our doctor, our master, Dr. Henneman, he was very intelligent, and he wrote this book, Organon. And if you have any problem, you get all the solution in that book. So Dr. Henneman described a term, idiosyncrasy. So these terms are very important. Individualization, which Dr. Rakhi told, every person is very different. So there is pollen in the air. Not every person will get the same symptom, same sneezing, same nose block. No, every person is different. So individualization is very important, and idiosyncrasy is very different. It is the same thing. Dr. Henneman described it in aphorism 116 and 117, and it is more advanced actually according to my point of view, because he said the same thing. Idio means one's own, sin means along with, and crazy means constitution. So its own person specific constitution according to which each person reacts. So he has written this definition: the corporeal peculiar constitution. One peculiar person, what constitution he has, though otherwise healthy, he doesn't have any problem, but he possesses a disposition to be brought into a more or less morbid state, means not a healthy state, a morbid state, by certain things, which can be anything, which can any of the allergen which I described you, to produce mm, they produce some symptoms in certain individual, which otherwise have no change in other individuals. So this is the homeopathic point of view of allergy, which is called idiosyncrasy, and we have to take care of that. And that's how individualization come. And we have to take every patient as a new patient. You can't see that okay, there are pollens in the air, and these are the things, and I have to give only this medicine to everyone. No, no two persons will get cure in single medicine. You have to see every person differently. You have to take every patient as a new case, and then you have to give medicine according to that. You have to tell them the management which I just described you, and then together with management, with exercises, yoga exercises, breathing exercises, gel neti, and the medicine, the patient will definitely get cured. So I will present you first, I will present you my cases, and then we will discuss these rubrics. Dr. Hanneman, Dr. Kent, and our masters, they have described everything. If you have the proper knowledge of refractory, you will get every symptom you want to see, and you will get medicine for everything. So I will describe it to you later. First, I will uh, show you one, two cases of mine. So this was Mr. S. He was of 38 years. He was living here in Dublin for like 5, 6 years. He came with the symptoms of continuous sneezing, a lot of sneezing, runny nose, watery nose, clear discharge. And he said, I cannot breathe. First, I get this watery nose, runny nose, and after 2, 3 days, my nose get blocked and I cannot breathe. I and the person come in so much distress, if they are having these symptoms, then they don't want to talk also. I don't know, I have sneezing, I have runny nose, just you treat me if you can do. I am taking antihistamines for like 5 years, and I am not getting cured. If you can do anything, you tell me, otherwise it's okay. I am taking nasal drops, nasal sprays of antihistamine. The doctor gave me the steroid nasal drop also, but I am having no benefit. So that time this person, he was not very willing to talk in detail, so he only told these things: continuous sneezing, runny nose initially, and then blocked nose. When he came after 3, 4 days of exposure, he was having blocked nose. And then I otherwise I am very healthy. I don't I all the year I am very fine, but this thing I have. Then modalities in these cases are very, very important. Modalities, thirst, these are the important differentiating factors of the medicine. So he was having this peculiar aggravation from in the morning 10 to 12 a.m. and in the evening 5 to 6. And when there is sun, then I have this problem in the morning. The As soon as the clock strikes 10, I started sneezing, and in the evening 5 to 6. And when it is cloudy, it is rainy, I am better. But when it is sunny, I want to go out, but I'm so scared. And then amelioration in rainy weather. Physical generals, thirst was normal, sleep was normal, except when the nose is blocked. Desire salty, spicy food. I don't want to eat sweets. So I didn't repertorize the case because there are particular symptoms of netramure. So in boric, netramure, it is written nose, violent, fluent coryza lasting from 1 to 3 days, then changing to stoppage of nose, making breathing difficult, discharge thin and watery like raw white of egg, violent sneezing coryza. Worse, sunrise to sunset, about 10 a.m. at seashore, it is an island, and heat. So every symptom was matching. So I gave metramule 30 for 15 days, and for his these allergic symptoms, I used one aqua dose of histaminum 1 m. And he was so fine after 15 days. He didn't come back. He sent me a testimonial by mail, and he said, I don't know what did you give. I am not sure if you give the homeopathic medicines or you gave some high dose of steroids. I don't know, because I am taking steroids for so many years, but I never recovered with steroids also, and I am completely fine. Still 1 month is left. He came, I think, in May, June and July, but I am fine. If I will have any problem, I will come back to you. But he never came back. And in this was of last year. This year I messaged him, how are you? And he was fine. He didn't come. He didn't take nasal spray. He didn't uh, uh, find the need of any antihistamines. He was perfectly fine. So this is the beauty of homeopathy. If you find the symptoms, if you take the case properly, if you see the patient, talk to him nicely. In this, I didn't take the full history also, because the symptoms were matching so nicely. and he was perfectly cured. The same, I will present you another case, and how every person is different, I will show you. So this is the second case, Mr. J. He was of 40 years. He came pollen allergy problem. I came in Dublin in 2016. It started as soon as I came. Symptoms were scratchy. He was not having that much of nose problem. He was having more eye problem and throat problem, headache. So scratchy eyes, so much severe itching on eyelids. My eyelids got swollen. It is always red. So much burning in the eyes. I have a runny nose, but nose is not a problem for me. Eyes are the problem for me. And then nose are okay, watery discharge, itching, little bit of itching, little sneezing, no blockage. I please treat my eyes. I cannot open my eyes. I have this scratchy feeling in my throat, and I have headaches. In childhood also, I was having a sinus problem. So I am having headache. I don't know it is because of this thing, or these are my sinus coming back. I don't know. That's that's all he was telling me. And the modalities, aggravation, outdoors, I'm very scared to go because I keep on checking pollen account on my app. So today also I didn't want to come to you because there is a lot of pollen count is very high. And indoor also, I don't know how I get relief. I am scared to go out. I find no relief anywhere. Amelioration, if I wash my face with cold water, that is the only thing I can say. But to treat, please treat these eyelids, these itching. So I prescribed him allium cepa again. If you see in boric materia medica, nose, sneezing when entering a warm room, fluent coryza with headache and cough and hoarseness, head, cathedral headache, mostly in forehead, worse in warm room towards evening, eyes, redness, burning lacrimation, sensitivity to light, burning in eyelid, worse in the evenings in warm room, better in open air and in cold room. So I gave him allium cepa and 3 doses of histaminum 1 m, and he was fine. He was completely fine. And I told him the same thing to manage, put the petroleum jelly around his eyes if he goes out, and nose. And I told him to wash his face. There is one Ayurvedic herb which is called trifla. I think some of the Indian people may know it. Trifla. So trifla water is very good for washing the eyes. So it helped him a lot. Like I told you, for nose, Jalneti is very good. So for eyes, that trifla powder I told him. So you have to soak that 1 teaspoon of trifla powder in the water, and then you have to drain. You have to make it clear. You have to drain the water in a muslin cloth so that all the particles uh, leave. They are not coming in the water, and then wash this water eyes with this water, and you feel so much better. And with this allium cepa and histaminum, he was perfectly fine. So see, the same pollen allergy, pollen counts, pollen effect, but one person was having this symptom, nose symptoms more. Second is having the eye symptom more. I told you the one lady also come who was having stomach symptoms. So you have to see every case as a new one. You can't be prejudiced that okay, this is pollen allergic season, and okay, these we are having this medicine and give everyone the same medicine. These are the basic things which we learned in our when we started college, when we started learning homeopathy. But when we start practicing and when we stay patient, we keep on forgetting. We have not to forget, and we have to remember everything, and then you can cure definitely. Okay, this is very interesting case of food allergy, what I was telling you. So this baby was born and she was 4 months when she came to me with all eruptions in the body, redness, severe redness all over the body, red eruption, mostly on the folds, elbows, neck. She was on mother's milk only. She was 4 months old. Severe itching, she could not sleep. The parents I asked them, itching aggravated at night, ameliorated by cold bath. Pediatrician diagnosed him with eczema, which cannot be cured. The doctor said, okay, I think this is the first baby because it is very common and this cannot be cured. You have to live with it. You will learn soon how to live with it. It cannot be cured. There are steroids cream. You have to apply that, and at this stage, nothing can be given. So the steroids cream, they will be fine. So she was a physiotherapist. The mother was a physiotherapist, and she came to me, and she was in very much distress that now my baby cannot be cured. So I started the treatment. While taking the details, I got to know that eruptions started after third month of vaccination dose. That was the only symptom I got. I took the mother's history, pregnancy history, delivery history. Everything was perfectly normal. Mother was very happy, no distress. They were here, and delivery was fine, no miscarriages, nothing. First baby, everything was very normal. She was normal during the whole. I didn't get any other symptom. Mother was in very much distress. She kept on crying that, okay, no, my baby will not be a normal baby. And only symptom which I got was the eruptions started after the third month of vaccinated dose. So I started my treatment with Mesarium 30, one dose mixed with the mother milk. Rubric was skin eruption after vaccine. There were three medicines, Mesarium, Sarsapilla, and Thuja, but the symptoms were matching in Mesarium because intolerable itching, eczema, worsened bad, fiery red areola. It was very red, very red. Where the eruptions are, it was very red, mostly on the fold of the joints. So I continued this medicine, one dose a month, and she was doing fine. The baby was better. Okay, next slide. So in the meantime, baby was 6 months old and parents started weaning. They started formula milk and some homemade basic food which we give when we start weaning. So condition got worsened. Whatever milk they started, formula milk, they changed 2, 3 brands. The part where this milk touched, there are eruptions, and baby cannot digest that milk. Loose motions started, vomiting started. So they tried, okay, this milk is not suiting, that milk is not suiting. So mother said that, yeah, and mother described me, even if I kiss her after drinking my milk tea, she has eruptions on that part. So she has definitely a milk allergy. She was not able to digest any form of milk except mother's breast milk, and she was on the food. Otherwise, she was okay with khichdi, fruits, apples, banana. She was okay. So I took this rubric, allergic milk too. Tuberculinum was there. Skin urticaria, milk aggravation, sepia was there. Skin eruptions, milk aggravation, calcarea and sepia was there. So I repertorized this case. The calcarea and sepia were coming. So I gave sepia 30 with tuberculinum 201 dose because of the miasmatic background. I gave tuberculinum 201 dose and started with sepia 30. And I told her not to give any milk product for now because let's see how this medicine reacts, and we will see that how she will be able to digest milk. So I waited for around 2 months. In between, mother tried some yogurt, and the baby was in very bad condition. Parents were very distressed, and they took her immediately to the hospital. And doctor gave them some treatment and told them to keep with them EpiPen because she has severe milk allergy. She can, if she will by mistake take some milk product, there can be anaphylaxis, there can be some shock. So you have to be with EpiPen all the time. EpiPen is a device, that injection pen type of device, which injects epinephrine to treat severe allergy. So they were like all the time they assumed that our baby will never be cured. She will not digest any milk or anything. So meanwhile, baby was around 8 months during all this process, and she has not started sitting also. without support. Walking with help, no. Generally, babies, some babies in 9 months also they start walking, and around 1 year, most of the babies start. But she was 8 months. She didn't want to sit. She didn't want to walk. She just lying down. So definitely her milestones were delayed. And because in the repertory after repertorization, these calcarea and sepia were coming. In the milk allergy, also calcarea and sepia was there. So I started with calcarea fos. So with calcarea fos, she started recovering, and I started this milk ladder. So what is milk ladder? If because she was a baby, she didn't. Uh, I had hope that okay, she will be fine by if we will start step by step, then she will be fine. So I started this milk ladder. So what is this milk ladder? You have they tell you that what to eat. One second third step by step you have to do. First step is cookie with the milk biscuit, little milk biscuit, then muffin, then pancake you can make with yogurt, then cheese, then yogurt, and then you start with the milk. So these are the steps of milk ladder. So I started this milk ladder and started this calcarea fos, and very nice recovery, very nice. It helped her a lot, and after about a year of treatment, she's now free from all the rashes, and uh, she is able to take many milk things like she can digest cookie, muffin, pancake, but cheese they don't give, yogurt she can digest, and they didn't try milk yet because they are very scared. So this is how wonderfully our homeopathy can treat allergies. And when everyone says that okay, the allergies cannot be treated, you have to bear these allergies all your lifetime, it is not true. We can definitely manage. If it is very high allergy, we can reduce it. If not fully correct it, we can definitely reduce it. And in many cases, if we go step by step, we can manage and we can cure completely these allergies. So this was my presentation,
Thank you.
and thank you so much. This is my email. If you have any problem, you can, any questions, you can mail me, and I will be very happy to reply all the queries. I think, thank you, Genoveva, for giving me this opportunity.